And we have questions about what kind of protocols we should do if we do get an infection. You know, basically there's only two ways it comes in the restaurant: a customer or an employee. So if we find out a customer has, what protocols do we need to take immediately? And what if it comes as an employee, what we need to take immediately? I do want to say thank you to Andy Camby, because Andy Camby's been very helpful with us, with my personal restaurant situation all during this crisis. One of the things, Mayor, that confused me was in one of your correspondence, you told it that, and I know that we all know this is a serious virus. We get that, okay? We don't feel we're the only transmitters of it. I mean, there's all other local business, but I don't want to see anybody else shut down either. But in your letter, you stated that there was two reasons why what I understand was it was attributed to large get-together in restaurants and large indoor parties held at private homes. Well, my question is, if 50% of your decision was about because people were having parties at home, I don't know what you want us to do to enforce that part of it. We can enforce our part in the restaurant, but I can't. I mean, I get out of work, I don't want to go to somebody's house and say, hey, you guys can't have a party, if you know what I mean. So we need to get an idea of when you think we can open. We definitely want to have some protocols from the Board of Health on what we do if we do get an infection. You know, I want to keep my employees safe. I want to keep my customers safe. I want to keep myself safe. But it just seems that, you know, it being that Pittsfield is the only city in the state, as I know of as of right now, we don't have indoor dining. We can just go over the line in Lanesboro. We can go to Lee. Last night I went to Lenox and had dinner with my friends. I mean, it's you know, people are going. I don't think people are just saying, well, we're not going to go out because we live in Pittsfield and we're going to the restaurant. And I'm not, believe me, I'm not an expert at this, but I believe we were allowed to do indoor dining as of middle of June. Okay, we were allowed to, and that was step 2 of phase 2, if I'm not mistaken. As of right now, I believe we're in phase 3, step 2 or 3. I'm not sure which one it is, but it just seems that all those businesses, and granted, I don't want anybody to close. All those businesses that the state at the time said were more of a risk than indoor dining are all still open. So we just want to know how we came down to that we're the only ones closed. When will we be able to open, and give us some safety protocols in case an infection occurs? I mean, we want to work with the Board of Health. I don't want anybody getting sick. I don't want my customers, all these restaurant owners are my friends. I don't want them getting sick. You know, and the other final example, and then I'll let you make a comment, is, yeah, there are some large gatherings at some restaurants, and we're not going to get into that. But I mean, a little place like Joanne's down on Elm Street, she's open till 1 o'clock in the afternoon. I mean, I don't know how she got incorporated to all of that. I mean, it's a little tiny restaurant, a little tiny breakfast spot. I mean, at Kelly's Diner, they're only open to noon or 2 o'clock. So there's no late night gatherings there at all. And I just feel it was the blanket was put on where it could have been maybe more randomly done to target the areas that are creating the problem. Now I'll let you comment on that, and then I'll come back on again.
Okay, great. So would it be helpful if we showed you the data that we use to make our decision, and then show you how the data is trending now? Would that be helpful to sort of anchor how we as a task force came to the decision to suspend indoor dining? Would that be helpful?
It probably would, if we knew how to accurately read it. I mean, I can read a recipe pretty good. I don't know about reading health data very good. You know what I'm saying?
Well, this is a very simple chart. And if you're willing, I will walk you through the data in it's very simple to understand. And I think it will help as we move through this conversation and start talking about how to reopen safely. I think it will help you see that we feel there is a trend that would allow us to reopen safely. So,
well, if we're looking for a trend to get us to open safely, let's hope the trend starts tomorrow.
Hey, Craig, we're looking for that too. We're looking for that too. Okay, so we're going to share a screen. So it's going to pop up, and I'm going to just walk you through this data pretty quickly. Okay, so can everybody see the screen okay?
Yes.
Okay, so at the top of the screen, you'll see the table is entitled Community Spread Only, does not include long-term care facilities. So what you're looking at is only community spread. This does not include the very high case counts that are currently taking place at the Hillcrest Commons. So this is strictly community spread. If you look down at the bottom of the very bottom of the chart, you'll see dates. You'll see periods of dates at the bottom of the chart. And I really want to emphasize that bright yellow line that's in the middle of the chart. So let's take a look at November 6th. You can put your eyes on the November 6th date and go straight up to the yellow line. Thanks, Ricardo. You'll see that we started around the 6th, 7th, and 8th to see a bit of a surge. Really, it starts around the 4th, right after the Halloween weekend. And we start to see this uptick in cases. And it's around this time that we are able to identify through our contact tracing interviews that a certain percentage of the cases are linked to private house parties and a couple of large gatherings that happened at some restaurants. So if you take your eye from the 6th and go 6 days forward to the 12th, and Ricardo, if you can put your arrow on the yellow line, and you can see the upward trend to November 12th. That was when the Board of Health issued the indoor dining suspension. Then if you follow 5 days forward, you can see the ongoing rise of cases right up until November 17th, where we peaked. So that was the peak on November 17th. So during that period of time, that 5-day period of time when indoor dining was suspended, we still could see that we had case counts rising. Then as we move through the month of November, for, really beginning November 22nd, for the next 8 days or so, we have a really good trend of lowering the case counts. Now, we are still not in as good of a position during this 8-day period as we were back on November 1st or in, September and October. So that brings us to yesterday, November 30th, and you see a sharp rise in cases from yesterday. So we are seeing a bit of a flattening. We still have an uptick of cases, but we are pleased to see that we've been able to slow the spread around the community. And this is sort of the data points that we use to make our decisions. So I'll leave the chart up, Craig, and if you have any questions, please feel free to ask, and we'll be happy to help you identify any elements of the chart.
Okay, so that yellow number I see as daily, a 14-day average per 1,000 population, 100,000 population. So is that just the city of Pittsfield, or is it the county? Because this morning I look at the state website every day, the COVID update dashboard, and as of yesterday, they said their latest case count was 2 cases recorded in Berkshire County.
So there are 2 factors to the formula that we are using, and they are the exact same formulas that the state uses. So right now, the state formula is calculating the 14-day average daily cases per 100,000 plus the positivity of the daily case counts. That's the green line that you see there. And you can see that we're at 2.29% today. We want to stay below that 5%. If we start to approach 5%, we're going to go into a red category, which none of us wants to get to the red category.
No, we don't. That's absolutely true.
So I would encourage you to check the city's dashboard, because this is very specific to our city. And it's the thing that the COVID-19 task force uses to make its decisions. This is the data that we are using.
Okay, so my question is now that I do, my chart's kind of covered because I got my little things over here, but it appears there was a spike. Are you anticipating that was from Thanksgiving? Because we weren't open, so it can't be attributed to us.
Yeah, right. So the conclusion that the COVID-19 task force made yesterday morning during our session is that the response that we put in place worked to slow the spread. And we're starting to see some different trends unrelated to restaurants because you haven't been open, but we're starting to see different trends such as more family household spread. So, we're monitoring those trends. We do have some anxiety about what will be the Thanksgiving surge. And so we're going to be carefully looking at the data from this week and early next week to see how that looks.
Okay, well, here's one of the concerns with the group that we talked about. As you know, January and February are the best months around here to have a restaurant open. We're looking at only 5 more weekends now till January 1st. And I'm afraid that the time, our final open window in order for us to achieve what we need to do is closing on us very fast. And I don't know if some of my friends in the restaurant business here are going to be able to make it. I don't know. I had one of my employees call me this morning and says, I look at what, do you know anything else? Because I had to go look for another job now because I got to have a job.
Yeah. So we want you to reopen. We want your restaurants to be successful. We want you to keep your employees. So Ricardo, you can go ahead and take that screen down unless you have more questions. We can go back to the chart if you want. So, on this point, we agree, Craig, we want you to reopen and we want you to do it safely. And so part of our task force session yesterday included a discussion about how can we help you reopen in a way that allows you to do it safely. And one of your questions was about protocols for what to do if you have a positive case, either amongst your staff or with someone who is a guest at your restaurant. And so, as always, our team and the Board of Health are more than happy to help you on a case-by-case basis because we can give you a broad overview, but each situation may have some unique elements. So, we want to make sure that if you experience any positive cases in your restaurant, that you let us know, because then we can help you immediately, not 3 or 4 days later when things may have gotten, beyond our ability to contain it.
Yeah, so, I understand that. And what I'm saying is if there's an initial protocol, so yeah, before even I notify you, I can put that into effect, then notify you. I think it'll be a quicker and a safer solution for everybody involved.
And I'm going to let Gina Armstrong give you the broad overview about what to do. Okay, great.
Hi, everyone. Thank you for being a part of the Zoom meeting today. Our ongoing communication with business owners, restaurant owners is so critical during every stage of this pandemic. We're all working together. We need this constant communication for updates and for questions and concerns and to add support to what you're experiencing in your specific business. So this is a great opportunity to share information, with all parties today. And so I do want to address your very specific questions about protocols for what a restaurant owner should do if they learn of a positive case within their customers or within their employees. And the Berkshire County Board of Health Association has developed a set of frequently asked questions. It's a 2 or 3, it's a 4-page document. We did send it out by email a few weeks ago, but I know everyone is bombarded with so many emails, it may have slipped through or slipped by, but we will resend this guidance document out to all of our food establishment permit holders, because as you said, you want to know what do I do the second I am informed by an employee that they tested positive or that they are a direct contact of a positive case? What do I do immediately? And this guidance of 10 questions will walk you through what to do regarding cleaning, regarding guidance on testing for the employee, when can the employee come back, and questions like that. So we'll send that out shortly after this call today.
Thank you. I did not get that email. And like I said, I don't know if it slipped through the cracks, but I didn't get that email. I don't know if anybody else did. But could you even put it in that guidance? Give us like a hotline that we can call sooner. And what number do we call to notify you immediately that this is what we've heard, and have you had any information about that?
So, well, the health department is always here for you to answer your questions. It's 499-9411. And as you know, our senior inspector, Andy Canby, is available to go through protocols such as, sanitizing and how long a closure would be required for cleaning and things like that. So you could reach out to Andy by email also, and that's acamby, CAMBI @cityofpittsfield.org.
Like I said earlier, I work closely with Andy about all this stuff going on. And Andy's been very helpful. I mean, he's been very, very helpful, very honest, and he's doing a great job. I'll just say that from my experience. Okay, so all right, so that's part of the question. So now that kind of the protocol thing's established, it's now the hard question. When does it look like we can open?
Okay, so we started talking yesterday, the COVID-19 task force, about how we could help you to reopen as soon as possible. And so the Board of Health is having a meeting tomorrow night at 6 p.m. and they will be discussing how to revise the order that's currently in place that would allow you to reopen. So that's happening tomorrow evening, and I would encourage you to participate in that meeting. It'll be by Zoom, and we can give you the contact information. But I think it's really important now for us to hear from you, since Gina and Dr. Kohlberg are here with us for this meeting, to hear from you about what are some of the things that you think you're willing to do or that you need help with in order for us all to ensure that your employees and your customers are protected, so that when the Board of Health starts to think about this over the next day or two, they have your perspective in mind. So if you have a minute, Craig, to just tell us generally, are there areas where you feel you're struggling, or areas where we could provide some guidance beyond just the initial protocols, which we've already covered? Is there anything else that you guys think the Board of Health needs to know in order to consider a reopening?
Okay, well, in the restaurant business in general, it's unlike all the other businesses around. We already had a set of sanitation rules. We always had Andy coming in and doing our codes, doing our inspections, make sure there's paper towels and there's soap, and we put hand sanitizer station in. Our tables are socially distanced. I had Andy come down and he checked and he said everything was fine. We installed plexiglass. We wear our mask. We clean. Every table is cleaned and chairs wiped out every single time somebody comes in, somebody can live. I mean, the party size is 10. I really can't fit a party of 10 in my restaurant. 6, maybe I could do an 8, but 6 is probably the most. And if you ask some of my customers, I was probably the worst guy at the mask police business, because if you stood up without a mask, I was yelling at you. In a nice way, just to keep people safe. And you're going to get customers that wander around. And, I always have to say, look, you can't be over here talking. You got to go sit at your table, stay with your group. And then but in general, you know how people are. They're going to wander. So maybe the Board of Health can give us some more paperwork or signs that we could post up, that orders from the Board of Health, so people can read it, that it's coming from the Board of Health and it's not coming from us. it's not us doing it. And I've had a lot of customers say to me, well, why are you doing that? I said, well, because I have to. That's the Board of Health. And I've actually had a couple customers who told me they refuse to come back in because we're making them order food. Well, I'm sorry. Those are the rules.
We could very easily provide you with materials that you can have on display inside your restaurants to help you with your customers. One of the things that we talked about yesterday during the COVID-19 task force with regard to reopening is that right now the state allows 10 people per table. And we have a lot of anxiety about that, especially when we think about reopening. I know some restaurants can more easily accommodate it, like Tony at Mazzio's can easily accommodate 10 people. A smaller place like Joanne's probably would not have 10 people at a table. So one of the things that I'd be interested in knowing is if we set a table limit of 6 and observed the trend for a couple of weeks, made sure that everything was still, you know, trending downward or flattening, and then we could revisit the possibility of the 10 people per table. So is that something the restaurants would be willing to work with us on?
Speaking for myself, I believe that would be more than fair for us to take a tiny step back instead of a big step back. And even before they went to 10, we were at 6. And people knew and we told groups, you got to split up. There's 10 of you got to go 6 and 4, or 5 and 5, or whatever, however you're going to do it. I can't speak for the rest of them with the larger restaurants because, like I said, the way my situation is here, I just can't fit a 10 top in there anyway. But it's better to have somebody filling the seats than nobody in the seats at all. That's right. I mean, you can, maybe some of the other restaurants can just chime in for 1 second here, maybe Tony or Mickey or Bill or anybody else who's on here, and just give her your feeling about that. Can we just let them do that for a minute?
Sure. Speaking personally, 6 is fine. People aren't gathering now anyways. And as you stated, let's get the ball rolling and monitor it and see what happens. But we have to start generating revenue.
I would like to say something if I can.
Go ahead, Bill.
Hi, my name is Bill Molnar. I don't know if anybody knew who I was, but I own the Madison Cafe. My business has been closed since March 16th. I have jumped through extensive hoops with the city to obtain a permit to sell food. I have spent considerable amounts of money to get my business up to code, to accommodate any customers that would come in. I have reduced my capacity. I bought plexiglass shields. I have done painting. I've done everything that the city had wanted me to do. And before I go any farther, I would like to say that every city department that I have dealt with, Andy Canby was fantastic. The fire department, the health department, the building inspector, the plumbing inspectors were all great. My concern is that every time I have to deal with an issue with the city, the money is going out of my pocket and there's absolutely nothing coming in. And I cannot afford too much longer to stay in this situation. The Madison Cafe has been in business for 86 years, and it would be a shame for a small establishment like that to have to go under. I'm not a big restaurant like some of the other ones in Pittsfield. I'm a little guy. I have a total staff of 6 people. I need to open the doors and let the people come in. That's the bottom line. I have to start making money.
So Bill, really, thank you for your honest feedback there. And especially thank you for the investments you've made in your establishment to ensure that your employees and your customers will be safe when we reopen. And we will reopen. We just need to get to some terms that we feel we can do it safely. And I think sooner than you may think, we will be able to issue some revised guidelines on reopening. But on the point of the table of 6, do we have general consensus from you that you're willing to move towards a reduction in your seating and allow us to observe over a period of time?
I have already reduced my seating at the bar by 50%, and none of my tables seat more than 4 people.
Great, great. Thank you for that. Anyone else want to weigh in on the 6
Well,
person?
Mayor, I think at this point that's a concession you want us to make, and that I think that's going to be an individual case by case. I am willing to do it. I don't speak, but if that's going to be the case, then it's going to be up to each establishment to realize that we can open as long as it's only 6 people.
Okay, great.
So that's my opinion. Now, I mean, if they want to go case by case basis with every restaurant, that's something different. But I know my opinion, and you heard Mickey's opinion, and
Yeah. I think in order for us to assess the science, the data, the transmission rates, it's easier if everybody is operating on a level playing field, right? Not only is it fair to all of you that you're on a level playing field, but it gives us a better ability to assess the data as we collect it once you've reopened. So that's something that I would ask Gina and Dr. Kohlberg to advocate for during your Board of Health meeting, that the restaurants be allowed to reopen with a 6-person per table guideline. Is there anything else, Gina or Dr. Kohlberg, that the Board of Health will be interested in thinking about, that you want to get feedback from the restaurant owners?
Not really a question, but I'd like to just mention what our observations were when we identified these clusters of outbreaks within a few of our restaurant establishments. We really could see how the transmission occurred, at those larger group settings, especially, without the mask and seated for prolonged periods of time, and how it kind of, swept through a group of people, and then it swept through their families, and then it then affected the workplace, in our schools and our daycares and other workplaces. And, so we really could see the difference it makes when multiple households are coming together, or people from various households are coming together for a dinner, and, especially with 8 people and 10 people. Someone is asymptomatic and positive, and they all, have a nice dinner together, and then a few of those people become infected and ill, and it spreads from there. So, we had to get control over this situation quickly, because there were several restaurants impacted by employees who were tested positive, and by issuing the emergency order for a few weeks, we saw how effective that was in control of the spike we saw at that time. And so now, reopening and looking at modifications to that smaller group size in restaurants, we think will make a significant difference. And we appreciate your patience and your understanding in the interventions that had to be taken when we saw how our restaurants were directly impacted in the month of November. And we hope going forward, our residents will also have a better understanding of, the safety measures that they can be taken when they're at restaurants or shopping in public, or, among their friends and family. So it's, we learned a lot through this, and, we're going to just continue to work together and prevent those outbreaks going forward by doing that together.
All right, the one other thing that I wanted to bring up was the concern that was raised about the restaurant rapid response program that we've put in place. And I know you mentioned, Craig, that there are some restaurants that might not meet the guidelines. They may exceed the guidelines. But what we've been saying to people is that please apply, and in your application request a waiver. And that will be taken into consideration as we look at the applications. So please encourage your network to apply for this program. Request a waiver if you feel like you might not meet all the guidelines, and that will certainly be taken into consideration. And this is a resource that will help you now ramp up for reopening. So please submit your applications. We've already received 17 applications. We have the ability to accommodate more. So please do submit those applications, even if you're unsure of whether or not you'll meet the eligibility guidelines.
Okay. Can I just go over a few basic questions before we get done here? Is there anybody from the restaurant business on the task force?
So the COVID-19 task force is comprised of my office, public health, public safety, the sheriff's department, Berkshire Medical Center, the schools. So it's really a task force comprised of public health and public safety officials. So we don't have anybody on the task force from any particular sector of the economy.
Okay, would there be any way that we could maintain some communication with them? I mean, I know you've had task force meetings. I haven't seen any results. Can we attend one? Can we just see what's going on? I mean,
sure. I mean, one of the notes that I made here was that maybe it would be helpful if we had maybe an every other week session with all of you to keep you up to speed with what's happening within the city in terms of case rates, what's happening in the economy. We would be happy to convene with you as a separate group so that we can keep you up to date.
that would be fantastic.
Great.
So my next question is, I mean, you spoke about if we went down, is there any other area that you're looking for us to, I'm not going to use the word concession, but in order for us to be in that meeting on Wednesday so that we get the chance to open up?
Yeah.
And the second part of that question is, of course, we felt one of the problems the group felt was at 5:15 that Thursday night, I got the email that we had to close in 7 hours. So, I mean, we would like to have, say, at least come out and say, we're considering this. If things look the way they are, we can open by such a date, because now we got to re-inventory. Now I got to get all my help back. We got all that. It was just not like turning on and off a switch. Yep.
So your first question was, I'm sorry, Craig.
Is it like going down to a 6-person count? Is there other things that you're going to require from us?
No. That was the one element of this that we thought would be helpful in terms of reopening and phasing it in a way that allows us to monitor how it's going. But I would encourage all of you to review the workplace safety standards that were issued by the state way back at the beginning of June, I think it was. Make sure that you're in compliance with all of that. And one of the things that is most helpful, and I know this can be hard for you to do, but to track your customers and collect contact information so that if you do have a positive case, our public health team can immediately intervene with anyone that might have been in your establishment on that night or during that day. So a simple, at your reservation desk or your check-in desk, just have a list where people can put down their name, their cell phone or their email, so that if we have to go back and do contact tracing within your establishment, we have an easy, quick resource for that. But other than the 6-person per table limit, I don't think we had any other ideas about a phased reopening. Just a reminder to please review and refresh your memories around the workplace safety standards, because that is something that if we get complaints from a customer or an employee, we're going to be looking to see if you're in compliance with those standards.
I do still have up in all areas of my restaurant, those little poster things that the state had, and the sign thing, and the checks that we did this, and the cleaning and the supplies. And I mean, I've never taken them down. They're still up there. So until this is done, they're going to be up there. So that being said, I like the idea of getting together a couple of weeks. I'm trying to now, our first thing in this coalition that we're trying to start was to get this meeting to get us to be reopened. And as we're going down the road, we'll be discussing, we'll be gathering emails, we'll be getting a list together. So it'll be very easy for us to communicate. I mean, I threw this together. I started talking with the guys on Thanksgiving morning, and we had the people signed up and ready to pretty much to go by on Sunday. Or Monday. So it'll
That's
be
great.
easier. And matter of fact, it probably will help us all in the long run, because if there's another outbreak like this, I'll be able to have instant communication myself with all these restaurants that have joined our little coalition, if that's what you want to call it.
That's great. I think that's really, really great, especially as we move through the holidays and start looking at the new year. And hopefully by mid 2021, we're looking at vaccinations. So having this open line of communication is going to be vital. And I know that Catherine has already collected email addresses for all of you. So I'm going to ask her to set up a every other week standing meeting so that it's on the books. You can put it in your calendars. And if things come up in the meantime, you know that you can reach out to the Board of Health or to my office, and we will do the best we can to respond to your concerns.
Okay. So are we going to leave it as the decision to reopen will be probably made Wednesday night?
I think that you'll likely see some discussion and decision-making at the Board of Health meeting tomorrow night at 6. I don't know if Dr. Kohlberg or Gina want to weigh in on that.
Yeah, the Board of Health, what we discuss at the Board of Health meeting tomorrow night, and part of that will be the public comment from anybody who wishes to attend virtually from this coalition. All of that will help inform the decision, and we are going to reconvene with the mayor and the task force on Thursday morning, which we've relied on each other since the beginning of the pandemic for each other's input. That will also help to inform. So I think maybe not concretely by Wednesday night, but I think by Thursday morning we will have a good idea of where we're going to go with this. And I just want to say, echoing what the mayor and Gina have said, is that I personally, and we all do, understand how serious a matter this is for the entire restaurant industry. And we are also, I just want to, as a matter of caution, that when we do reopen for indoor dining, that we will be doing that with the recognition that we are entering a precarious time in terms of the spread of the disease within the community. We are seeing even a slight rise now, which I don't know if it's foreshadowing an even bigger rise following Thanksgiving, but we're seeing quite a few cases still in the community, and about double the number of cases today that we saw yesterday. So we're all kind of holding our breath here and waiting to see how things shake out from Thanksgiving. So the timing of opening restaurants comes at this very delicate time, and we all have to really double down on the health and safety regulations that have been put in place. Just to repeat what's been said. 6 people per table, try to ensure good ventilation in the restaurant. And it's very important that even though there will be 6 people, no more than 6 people per table, to try to limit the amount of cross-contamination between tables so that there really cannot be, as Craig pointed out, that when he saw somebody without a mask and he called them out for it, that there can't be a lot of socializing between tables, because that is bringing into contact people from different locations. And it would be like in effect having a table of 10 if you're having a lot of socialization between tables. So please try to keep that in check. And the health and safety regulations that Gina alluded to will contain all of these recommendations. So just let's all try to, be very careful.
I just want to clarify a point that Dr. Kohlberg just made about Thanksgiving. So we know if we see a spike in cases during, in these coming days, that it's not going to be restaurant clusters because you haven't been open, right? But our concern is if people are coming into your restaurants, ensuring that you have all the protocols in place to try to prevent the transmission if we are in, a period that has spiked because of Thanksgiving. So that's why I think these ongoing sessions with you are going to be really important to keep you informed of where we are in terms of case rates. I know it's confusing, so hopefully when we meet, we can clarify these points. So I know that Rick Simony has a question. So Rick, if you want to. Okay. Rick, why don't you go ahead and then we'll go to Melissa.
Rick, you should be unmuted. I think you just muted yourself again. Try that.
You might need to unmute your phone, Rick, if you're calling in on your phone. Okay, so while we're waiting for Rick, why don't we have Melissa ask her questions.
Thank you. Thank you everyone for, for being in here. I have a couple of things that I was listening to. Craig, you did a great job of, trying to take on this for all of the restaurant owners, all of us and everything. But it points me back to a couple of things when we were talking about the task force. And Mayor, you were talking about who was on the task force and how you haven't had anybody from the food service industry on it. And I think this is where the biggest disconnect is coming right now. It's always easy to make, try to make decisions that you feel are the right things for everyone. But if you don't know all the nuances of what it means to run a business, like with Craig saying he just got his order in and then, 3 hours later or 24 hours later, he's being told he has to shut down. I mean, there's product that has been, has to be ordered ahead of time in order to be cooked and set up and stuff. And those are the things that you wouldn't know unless you are in the business. So I think something of this magnitude, of this importance, and considering that only the restaurant industry has been the one who was caught, has been able to having to shut down, that it's imperative that somebody from the restaurant industry sits on that task force. And then because of the fact that if you've got people from, the schools and all of that, and you're trying to get all that information disseminated out into the groups, this way here, as Craig was saying, he's got all the emails, he can go back, bring you questions and bring back answers to the group. So I think it's really important that somebody gets put on that committee. And as I was listening to a lot of this and my frustration of all of this happening over the last few weeks is that, and I can't speak for everybody, but I know personally, for our restaurant and things, we have done the contact tracing. We have 2 points of contact. We've done everything that the state's told us to do. And when the mayor or the governor comes out and says it's safe to open up and allow indoor dining at 6, and then he went to 10, the entire state is still at indoor dining and they're still at 10. So it's not the 10 that's the problem. It's what happened here is the problem. So I think that, we can't be throwing everybody out with the bathwater. I think that the fact is we have to really ramp up our contact tracing, our issues when somebody gets called in and there's an issue in a restaurant, it has to be all hands on deck to find out going forward. I feel personally that it was just a knee-jerk reaction. Let's shut everything down. And as Craig pointed, in 3 minutes, you're over the line and you're in Lanesboro. As Mickey pointed out, you shut down his 2 restaurants here, but yeah, everybody could go over to Mario's. Unless the whole state shut down because it was a disaster, it's not working, because those people are still going to come right back in. So I really feel that the task force needs to have somebody from the restaurant. And I feel that, obviously something went wrong, and we all learned the lesson. We saw it happen. But I think going forward, it's the communication, and the minute something happens in a restaurant, if it's that one didn't, not even a restaurant, you go into a hair salon, a nail salon, if somebody's not following it, they get shut down, not the entire industry that surrounds them. And I think that's something that I've been listening to, and talking with a lot of these owners for a while now, and this is the frustration that they're hearing. So I'm really glad that everybody's on here. And I think that in this economy, the only way we're going to survive, especially the winter, and everybody knows in this business how hard it is that we've got to do everything we can to keep every single person open that can be open as safely as possible. And so I think, moving forward, I think you literally have to have somebody on that group so that they continue to bring back that information. So, that's really my 2 cents that I've got to put in there.
Rick, do you want to try again, or maybe?
I don't know. Can you hear me now?
Oh, yep, we got you.
Kind of figured it out. Okay. I'm all great with that 6, 6 at a table. That'd be great. I just had a question about on your chart. When you had that chart going, I think that in the yellow line, was that all like people, 37 people, or when it was between the two, like when you're climbing up the chart? So in other words, what I wanted to say was, like, we all know that there was a couple big parties that happened. And you eliminated, say, I don't know if you guys have the data about how many, if it was like 100, 120, something like that. If you took all those off, would that drop that yellow line way down, first of all? And then second part is, like they were saying, everybody was saying, Craig and Melissa said, everybody's going to other places. So don't you think that now these people are having maximum out in their places? Now you're having way more people in one spot than having it distributed all over the city, our city, instead of going to these other towns and having at the bars or restaurants, and they're maxed out. So now you're putting more people all together. And what does the doctor think about that? That's just one of my questions. That's it. Thanks.
So on the chart, so definitely if we took out the number of people that were identified as the clusters associated with the private parties and the restaurants, certainly that would lower that yellow line. So that's definitely the case. And you can see already when you're looking at the chart that it has started to flatten during this period of closure. So we want to get you back open, get you back in business with just a tweak to the number of people per table. We'll monitor the case rates, and we'll keep moving forward. And I know, Dr. Kohlberg, we've heard from people about this issue, about people were able to go to other communities, to go to restaurants. We understood that might happen when we imposed our temporary suspension. We had also in our city a very serious surge that we needed to respond to. So one of the things that we've all learned, at least I can speak for myself and the members of the task force, is that we are literally making decisions sometimes one day at a time, 1 week at a time, because things change fast. And you could see just in one day how we've started to climb again in our case rates. So we're doing our best to make decisions that will respond to slow the spread, but have the least impact to the economy. Dr. Kohlberg, did you want to add anything to Rick's question? Dr. Kohlberg, you muted.
I know, I just realized that. No, I would just add, echo what you said, Mayor, in that we had to make we saw the data that was coming out of Pittsfield, and we had to make it the best decision. We did have conversations with folks from other communities in the surrounding area. It's not like we made the decision in a vacuum, and some considered closing, but they just don't have the same kind of restaurant presence and population like Pittsfield, and we just had to respond to what we were seeing. You know, it's not like the restaurant industry was being singled out. It just happens to be a locale where people get together in groups without masks, and it's just the nature of the beast. We had to respond to what we were seeing, and the restaurants happened to be one of those areas where we were seeing clusters arising from. So we, by the same token, we realized that it's not all related to restaurants. If we were talking to a group of party planners, we'd be saying the same thing right now. And we're going to try to, we're going to see that the restaurants reopen in a safe way, and hope that it produces minimum impact on the community as a whole.
Can I say something again? Can I speak?
Go ahead.
Yeah. So, I guess, and I try not to take this a little bit personally, but we keep hearing, these private parties in restaurants. And so when you say private party, and the general public feels like it's these, secret kind of parties. A table of 10 or a table of 6, that could be, if it's 6 people who know each other and they're only the one sitting there, that's a private party. That's a private table. So I think, a lot of it's been circulating out in the community, which is really unfortunate, is that this started at these private parties. If you clearly know exactly where it started, because you have contact tracing, you should know. So you can basically say, we've had some incidences and we are now working on it. And if I was, looking at the data and I was noting that, right where you got to go. So go there. I think that shutting down all the restaurants, it was just such a knee-jerk reaction. If you knew your data and the people who are giving you the data are following the protocols, you should know. And I feel like you all didn't know, so we basically just like, well, we're just going to shut everything down. No one else in the Commonwealth has had to shut down. And I mean, come on. And so when we do something like this, it's at this time of year when we're struggling already. So I don't see why we couldn't say today, all right, you guys can open. We've all had this conversation. We've beaten this dead horse. Everybody's doing the right thing. And if they're not, you should be able to find out ASAP. And now you're struggling with the, nursing homes and things like that. Are you just going to go in and boom, shut them down? If it's something, a complete industry, you have to go in on a case by case situation. And that's what I think you should have done. Or if you did, it didn't work out that way because we ended up doing this mass closure of just Pittsfield, and it's like, but everybody went all over into, to different communities. And when you say, Dr. Kohlberg, Pittsfield's a hubbub of restaurants, I disagree. There's a lot of restaurants out in the Lenox area and some of those other areas in Williamstown and all of that. There's a lot of restaurants. Everybody on this board has traveled over the border to another restaurant within the last week because everybody talks about it. So we all know, and they haven't got COVID and we haven't got COVID. So please, I think it's time to let these guys open back up and then get somebody on that task force so that going forward, if there's an issue, everybody understands where it's coming from. And I think we have to stop saying that there was a private party in a restaurant. Can you just clearly said these spikes over Thanksgiving, all your restaurants were closed. So I think you're going to, I'm getting upset because I feel for every single one of these people, including my own family. But it's like, and if 99% of people are doing things right, you can't punish everybody. But I think that we all want each other to succeed, and everybody here really wants to just get back to doing what we all do. Because the more restaurants you have, the better your business is going to be. Because everybody knows that competition is a great thing for restaurants. Choices are good. And right now we don't. So thank you.
Mayor Tyer? A question I have now is that, okay, so I feel that maybe we should get somebody on the task force, not as a voting member or something like that. But if we all get together as a group and we have one representative, I think it'll be easier for us. We can maybe stop something before you can even do it. You know, if we're in our group, we'll say, look at guys, we're all on the same team here. And if one strays off the path, then hey, this is what it is. And I think we'll be able better to self-control ourselves. And at least have us, you know, if something happens, we can go, hey, look at, we investigated ourselves already. This is what we felt happened. How do we do it? Do we correct it? And we can self-discipline. I mean, we're grown adults. We're grown adults. We're businessmen. We should be able to self-discipline ourselves to make sure that none of this happens again. I know when I was a kid growing up, my brother did something bad. He got in trouble. I said, well, I know what? I ain't doing that anymore because I'm going to get in trouble myself. So I think as grown, you know, as businessmen and women in this community, we take on the responsibility. Let us stay together as a group. We, let's just have an advisor. We can just go in and you can ask us questions. We wouldn't put any input into the task force meeting, but when something comes up about our industry, we would be there to answer all the questions that you have. You know, there's some stuff that goes on in the schools. I don't know what that would. That'd be nothing to do with me. But the restaurant business, I know it. Melissa's family knows it. Mickey, all the group, everybody in the group knows the restaurant business, and that's what we do. And believe it or not, there's a lot of friends in our restaurant business here in the city of Pittsfield. And actually, this has made it grow. I've met a lot of other ones that I normally wouldn't have met doing this. And everybody's on the same page. You know, let us do our jobs. We'll do it to the best of our ability. We know what's going on now. We know why you closed us all down. Now we know what not to do. Unless, like I said, we'll get our group together. We'll self-police ourselves. And just do what we have to do. And if somebody has a question, like, you know, some of these smaller restaurants, they have a question, then maybe they can come to me first or come to Tony or Mickey, and then we can go out to you and say, okay, this small person has these questions, but didn't know how to communicate with your office.
So I think that, in my view, is the benefit of having these group sessions on an every other basis so that we can hear from all of you. And in the meantime, you have a direct line of communication to my office or to the Board of Health if there's something urgent. And if we're discussing something in the task force side that might affect restaurants, we'll bring it to you.
Okay, I mean, let's get that promise that you will keep communicating with us. And the other thing is that if something happens in another restaurant, I don't want us to all be punished again. I think you need to take the case by case, like Melissa said, of where the infraction was, how was it caused, was it due diligence, or, you know, no due diligence, were everybody doing what we're supposed to do and it happened, and go that way. Because I just don't feel that we should blanket collar every restaurant in the city if a problem occurs someplace else.
I hear you.
Mayor, if I may, as a member of the task force, I can't speak for you because it is the mayor's task force, and the composition will ultimately be a decision you will make, and perhaps the rest of the task force will make as well. But make no mistake, we have all the entire task force has done its due diligence. We're all customers of the restaurant industry and every other business in this city. And I say without reservation that we have done our due diligence in taking everything into account and have had extensive conversations regarding all sectors of the community. So Craig, please know that we have all taken this very seriously and do understand the impact it has had. And one thing that this pandemic has taught us is that we have what seems to be true one day, we might be doing an about face a couple of weeks later. There's no precedent for this, and everybody has worked hard to, number one, ensure the health of the people of Pittsfield with, as the mayor said, with as little impact on the economy at the same time. So
I would just like to add for the benefit, I think every restaurant owner on this call would benefit from familiarizing yourself with the dashboard that is on the city's website. And I know data can be overwhelming, but particularly given that your businesses are so dependent upon interaction with the public, understanding on a day-to-day basis what is happening with the data and what is happening with this pandemic in the city. And that data is posted every day. And you can go in and look at it and use some of the different drop downs and see the data. And so you can see almost at the same time as we do the data that is out there. And I'm confident that many of you, if you had been watching it, and I know you're busy, you would have seen what was happening that week after Halloween, and would have put two and two together as to where the risks were for the community. And now that the mayor walked you through some of that data, you'll be able to watch and understand with more understanding what is happening in the community. And as you said, the next 6 weeks are very important to each of your businesses. And the next 6 weeks are the riskiest we've faced yet with this pandemic. And so doing everything you can to make sure that the pandemic doesn't come in and impact your businesses any more than absolutely necessary, I think can be helpful to you.
I gotta say something.
So in closing, I would encourage all of you to participate in the Board of Health meeting that's scheduled for tomorrow evening at 6 o'clock. It's very important that the members of the Board of Health hear from you. And then the task force will be reviewing the Board of Health recommendations Thursday morning. And hopefully we will have a decision for all of you by Thursday afternoon or Friday morning. So thanks again, Craig, for your willingness to
hang on a second. I have a question.
Sure.
About the grant.
Oh, okay.
So why is there a threshold put on a grant? Because the standard's the same for everybody anyways. If you have 2 employees, 20 employees, 30 employees, you're only going to get $5,000. And using last year's numbers have nothing to do with the situation this year. Thank you.
So we wanted to make sure that we had as much funding available for as many restaurants as possible. So that's why we put the cap at 5,000.
But with that being said, the city was ready to invest a lot of money in one restaurant on North Street, but we're not getting the same treatment, the 30 eateries. I'm not sure how many they are in Pittsfield, but I believe everybody's entitled to the money and everybody should get a check.
So the funding is being made equitably available to everyone. And the funding was specifically, the 5,000 funding is designed to help you during this temporary time period, because we did recognize that there were issues like inventory orders that and employees that were affected by it. So it was set based upon a very short-term need here. There were other funds previously available that were of greater amount, and there also are other funds that have been made available through state sources. So we are not the only one. We put this program in place specifically to be responsive to recognizing that the action taken for the closure was going to have an immediate impact.
I know you guys are talking about even the state stuff. I just applied for the $75,000 grant from the state through the MGCC, and we just recently got an email back that due to they're only going to be able to accommodate 9% of the businesses under 50 employees in the entire state. 9% of the applications. That's all they're going to be able to.
How do you? I have a question.
Craig, keep in mind that you are in a gateway city, so you are one of the priority communities.
Okay, well, I knew there were steps and that, but like I said, I applied for it and then I just get an email back saying it's only gonna be 9%. So I'm looking here going, well, it looks like we're gonna be out on that. And why, I just want one more question, Mayor. Can someone from the health department email me, or email us the link so we can join the health department, whatever the meeting you have tomorrow night for the Board of Health? Could you please have those, everybody email that to us, so if any of us
Yeah.
that want to go and join, and I mean, I'll sit and mute out, I don't care, I mean, but if you want somebody's opinion, I'll be more than happy to give it to you.
Yeah, so we'll have Gina email it to Catherine because she's already got all of you in an email distribution list. And so you'll get an email from Catherine with the link to the Board of Health meeting,
Okay, and what time is that Wednesday night?
6 o'clock.
Okay,
Back to the grant, I have a question. How many restaurants did the city disqualify
We've
with the
received
thresholds?
we have received 17 applications so far, and we haven't disqualified anyone yet.
No, Mayor, how many restaurants have you disqualified with putting the threshold amounts in?
I'm not sure I understand your question.
Well, you put a cap if you did more than 1.5 million? Is it disqualification?
So you're talking about in terms of your annual revenue?
Yeah,
That was a standard benchmark that we've used for all of our economic recovery and relief programs. But as I said at the beginning of the meeting, please don't let that stop you from applying, and please request a waiver.
but again, how many people were disqualified? You guys should have the answer because we all pay meals tax. You know exactly what we do in revenue.
We don't know
No
that.
one has been disqualified at this point.
What's that?
No
Yeah.
one has been disqualified at this point.
Well, you're disqualified by the thing at 1.5 million, and that's last year's numbers that don't do any good for this year's situation. And you do know the number because we pay city taxes. All you gotta do is back into everybody's sales tax you receive.
Again, we have said that we are waiving that cap in this situation. And simply to note that on your application. So no one has been disqualified.
I think you're disqualified a lot. I'm disqualified even on the losing percentage of it. So I disqualified twice from the application that was sent out.
okay, so my question is, let's do it this way. I know, Mayor, you said we could request a waiver.
Yes.
Could, because I've already filled that application and they requested more information, I just stopped at that point. So could you guys send us something that we can fill out and resubmit so we can ask for a waiver?
Here's the thing. My only question is we're all closed. It doesn't matter again, how big, how small, we're all shut down. Thank you for your time.
Okay, can I suggest with that application, there was a point of contact, Pittsfield Small Business email that was provided with it. Please communicate with that email. And Craig, in your case, one additional piece of information had been requested. And as soon as you provide that information, I believe there was actually a conditional approval that was granted. And so it's unfortunate if you decide not to go forward, but in your case specifically, it was one additional piece of information that was being requested. And I would
Can I just apply for the waiver now to disregard that last piece of information?
The waiver we are saying is the waiver of the income cap, the gross income cap has been waived. Or you can request a waiver of the gross income. And so if your reason for not providing the last piece of information was that you believed you did not qualify as a result of that, then I would encourage you to go ahead and submit that information.
Well, that is the reason why, because I figured I wasn't going to qualify and I wasn't going to spend any more time on it. And
Okay, so that all you have to do is follow up, and Lori Mick is on this call and listening.
I don't have that email anymore. So like I said, can some office just forward it back to me so I can continue?
Lori will send you the email, and I would encourage anyone else who believes that there is any part of the application that has disqualified you to specifically refer to that in an email, and the office will speak with you directly.
Just again, you guys want to help. We're all shut down. So it should be fair. Write the check to everybody and let's all move on.
Tony, that's what we are saying. We are asking for specific information to meet the requirements of our funding sources. So
But
you have to
you have the
simply
main,
apply.
you have the main information. We are all shut down for indoor dining. And thank you.
And Deanna, can I just ask you one quick question? Nothing to do with that part.
Sure, go ahead, Rick.
I was just wondering on when she was telling about the going on the website you guys have for the tracing and stuff. Does it say where people got on that? It doesn't say where they got it. So if you look at the tracing, whether it's going up or down or whatever, those people that got infected, it doesn't say it was from bars or it can't say where it, if you know what I'm saying, because it's going up, say it goes up, but is it from the bars or is it from the holiday parties, or it doesn't give you that information? Or
Right. So
Thank you.
on the dashboard, we are not collecting the clustering information. Gina, did you want to say something about that?
Yes, I could add a little bit of more information about what we were seeing with our clusters. So the information we reviewed and assessed with the Board of Health and with the task force was from our contact tracing team. So we have a handful of public health nurses that conduct their interviews with the positive cases and the close contacts of the positive cases. And so there were events and specific gatherings, both with indoor dining at a couple restaurants and also in private house parties where many restaurant employees were exposed to the virus. So it was through information coming in over the course of a week from our contact tracers that informed the decision that immediate action had to be taken to stop the spread with a broader community transmission. There was a high risk because of the high number of restaurants that had cases, either positive cases or close contacts among their staff within the week, while we were also seeing very high transmission rates in the general public. So it was really that input that's not, that specific detail is not included on the dashboard, but it's very, firsthand information from people who are in communication with those that had exposure.
Okay, thank you. And one more question, that's it. Can we get a copy of this whole Zoom message? Is there a way to get that on your computer or download it, this whole meeting here, or is it already on there?
If we go to CityLink, like the other night when the city council meeting was on, you could go back down and you could see the whole meeting. Will that be on the CityLink and available for everybody to see?
No, it's not, because this isn't being broadcast through PCTV right now. So we can find out about the technology and get back to you on that one.
Thank you.
Well, it does say you guys are recording it at the very beginning. Hello? So at the very beginning, it says, please note that we are recording this meeting. That's from the office of the mayor. So you guys are recording it. So you should be able to send out the link to everybody to get an email, right? To get this.
We will check with our technology staff and see how we can transmit it to you.
Appreciate it.
Thank you.
Oh, Mayor, I see we've exceeded our time limit. I think we've answered some questions. Thank you and your staff and the health department and everybody for talking with us. We do want to remember, we want to stay in contact every 2 weeks. We will all be looking Thursday morning, because Thursday we need to order for Friday. Just keep that in the back of your mind. And I got to tell my employees, you know, some of them have kids, they got to get babysitters and stuff like that. So, you know, as soon as we know, the better off for us and our industry. So like I said, I have a lot of part-time people, their mothers, they have children, they have sporting events, and people have other jobs that they have to work around. So as soon as we know, so we can tell them and be ready to go for the weekend, we would really, really appreciate it.
We got it. Okay, thanks, everybody. Have a great afternoon.
Thank you.
Thank you.